friends! Okay, let's take a look at another arterial blood gas example. So in the previous video, we said that a normal pH is going to be 7.35 to 7.45. So taking a look at this, 7.32 is low, which will cause acidosis. Now the question is, what is the cause of that acidosis? Is it related to the lungs or is it related to the kidneys? So let's look at CO2. We said previously that CO2 is an acid, so higher levels of CO2 will contribute to acidosis. Now, we said that the normal range, if you remember from your pH, you can take the 35 and the 45, and that's your normal CO2 range. So 31 is low. In the previous video, we said that you can look at the direction of your pH and your CO2 to determine the cause. If they're going in the opposite direction, one's going low, one's going high, then it's likely respiratory in nature. But in this case, where they're going in the same direction, they're both low, this is most likely a metabolic acidosis. Now, always important, I cannot stress this enough, make sure you're looking at all three pieces of this puzzle before you draw any conclusions. So let's look at our bicarb. Bicarb, we said, works as a base. So the normal range is 22 to 26. Therefore, 18 would be low. Does this make sense? Yes, it does. If this patient is experiencing acidosis that is metabolic in nature, that means that there's a problem with the kidneys. The kidneys, which are the organ responsible for producing bicarb, if they are not producing sufficient bicarb, or if the patient is experiencing extreme nausea and vomiting where they're eliminating excess bicarb, that will contribute to an acidosis. So I feel confident saying that this ABG is indicative of a metabolic acidosis. Now let's look at the CO2. Because it is low, that tells us that the lungs are trying to blow off extra CO2 in order to correct that acidosis. But because our pH is still low, it is not compensated fully yet. There is partial compensation, but not fully. So this is basically an uncompensated or partially compensated metabolic acidosis. Let me know down below if you have any questions, if there are any other questions related to nursing that you would like to talk about, or if you'd like to see more ABG examples.